We all have some emotional relationship with our hair. Whether we wear it long or short, a certain amount of time every day goes into grooming hair. It is through the course of this everyday habit that people first notice hair fall and other changes in the scalp and hair. Thinning hair is often worrisome since it is the first step, among many, that can lead to permanent hair loss and eventual baldness. The thing about hair fall is, it happens every day. An average adult head would have about $100,000 to $150,000 strands of hair. Out of these, it is normal to lose about 50 to 100 strands of hair every day. The problem of hair loss and thinning begins when the phase of hair growth does not keep pace with the phase of hair loss. In order to understand it more, it is important to look into the life cycle of hair. Stages of hair growth. Normal phases of hair growth. There are different phases of hair growth, including anagen, catagen, and telogen phase. After completion of the last stage, the entire cycle is repeated. Every single hair undergoes these three phases of growth independent of the other hair on the scalp. 1. Anagen phase, growth phase. It lasts for 3 to 5 wears. This is the active phase where hair root divides at a high pace and results in hair growth. At a given time, around 85% of hair strands are in this phase. 2. Catagen phase, regression phase. Around 3% of the hair are in this phase at a given time. It lasts for approximately 10-20 days when the hair strand stops growing. 3. Telogen phase, resting shedding phase. At a given time, approximately 10% of the hair are in this phase. It lasts for around 3 months, after which the hair falls. As long as the hair continues to regrow at the same speed as it falls, naturally, hair loss is not an issue. However, when hair shedding phase is going on at its own pace, but the growth phase, anagen phase, is shortened, then less hair grow at a given time in this short time span, as compared to normal hair growth, while more hair continue to be shed at the same time. In such cases, hair loss is visible and requires treatment. Homeopathy for managing hair fall. The top listed medicines in homeopathy to manage hair fall are 1. Phosphorus for excessive hair fall. In bunches, phosphorus is best medicine when hair falls out excessively in bunches. Mainly, hair fall occurs from the forepart of the head in cases needing it. It helps to control hair fall and stimulate hair growth wonderfully. Persons who require this medicine may have dry hair. They may also have dandruff and itchy scalp. It is also a prominent medicine for premature graying of hair. When and how to use phosphorus. This medicine is the best bet for hair falling out excessively in bunches. It helps control hair fall and also promote hair regrowth. It can be used in 30C potency 2 times a day. 2. Fluoricum acidum for hair loss. In spots, a person having hair loss in spots, alopecia areata, can find this medicine beneficial. It prevents further progression of hair loss and promotes hair regrowth in the already present spots. It is also a good medicine when hair strands are brittle and dry that tend to break off easily. It helps in decreasing dryness in the hair and preventing hair breakage. Lastly, it is also the best for controlling hair loss after fever, particularly typhoid. When and how to use fluoric acid. Its use is highly recommended to manage hair loss occurring in spots. Though it can be used in different potencies, but in beginning, it is best to take it in 30C potency twice a day. 3. Wiesbaden Aqua for hair regrowth. It is a natural remedy to aid hair regrowth. It is sourced from springs of Wiesbaden in Prussia. This medicine is known to aid the quick growth of hair. It also helps make the hair dense and darker in colour. It nourishes hair roots and makes hair healthy and strong. When and how to use Wiesbaden Aqua. Use of this medicine is frequently recommended to promote hair regrowth. Its use is suggested in 30C potency 2 times a day. 4. Phosphoric acid for hair fall from grief. It is useful to treat hair loss that occurs as a result of grief and sorrow. Those needing it experience marked thinning and falling of hair. They may have early graying of hair as well. It is also valuable to treat hair loss occurring in beard area. When and how to take phosphoric acid. Anyone experiencing hair fall due to grief can take this medicine. It gives excellent results here. Initially, phosphoric acid 30C can be used twice a day for best results. 5. Thallium met for hair fall. After acutely exhausting health conditions, it is highly suitable to treat hair fall after acute exhausting health conditions. For example, flu, throat infection, prolonged fever. The hair fall is quite rapid in cases needing it. It may be general hair loss all over the scalp or in spots. The hair comes out in handfuls. When and how to use thallium met. This medicine can be used after some acute health condition like flu, prolonged fever. This medicine can be taken in 30C potency once a day. 6. Lachesis, falling of hair during pregnancy. 7. Borax, hair rough and horny, cannot be combed smooth. Hair tangle at the tips and stick together. If these bunches are cut off, they form again. 8. Pulsatilla, sensation of hair in eyes. Nitric acid, profuse falling of hair, especially of vertex with eruptions. It may be due to syphilis, nervous headaches, debility or emaciation. Scalp sensitive. 9. Sulfur, very unruly hair, sandy, harsh and lusterless, growing in every direction. 10. Medorrhinum, falling of hair with itching of scalp, better at seaside. 11. Sepia, falling of hair during menopause and pregnancy. Losing of hair during headaches, no desire for conjugal relations. 12. Natrum mur, falling of hair in pregnancy, losing hair after chronic headache. 13. Selenium 30, falling of hair from the whole head leaving the scalp smooth and hairless. Falling of hair from eyebrows and face, giving a strange appearance. 14. Alumina 30, extensive falling of hair of the scalp, parts become entirely denuded. Falling of hair all over the body including eyelashes. Note, 30 potency should be used 3 times a day. If you find suitable selected remedy effective for short time, then 200 potency should be used after every 3 days. For more information, you can contact me through comments. Best combination for hair problems: Calcarea flower plus Silicia plus Kali Sulf. Kali, Pheos plus Natrum, Mur 66, 3 times a day.